Much better. Um, let me delete this one. Is it like this?
No spaces.
Oh, no space. Oh, okay. And then I'll do it right at the page. I'll do it right at the end. Okay. Welcome. Masquera say. How are you doing? May you please kindly tag someone if you know they are a woman, because the topic that we are going to talk about today is none other than menopause. I think I've had requests where people have said, "Kuti, Auntie Selina, talk about menopause." And I said, it's a topic whereby if we don't have someone to talk to us about it, it will be difficult, because inini wacho andini anditozivi anything about menopause. So please kindly tag someone so that they can hear as well. Mazimai Amara, a very good afternoon to you. I can see you. Maiku, I can also see you. How are you doing? Auntie Josephine, say, how are you doing? Masquera say. Shedzana iwediwe. Shedzana. I know live inozogona kufamba well after we have done it, and also sharing will be ideal so that other people that are on your pages will get to learn and to know more about menopause. Okay, I think I won't wait longer for other people to come. They can always come and join us as we go on. Auntie Irene, how are you doing? Masquera say thank you so much for coming to the program. Today I've got a special guest in the house who has traveled a very long way to be with us, to talk to us about menopause. She's none other than Sita Chitambo. Sita, welcome.
Hello. Thank you, my Selina. Glad to be on your platform, and thank you for hosting me on your platform.
Thank you so much, and thank you for accepting to come and talk to us about menopause. Menopause. What is menopause?
I know it's something that in our culture it's not well explained, and yet every woman goes through menopause. So menopause, that's the period when you stop having your periods. Paya patinenge takuti auchaendi kumwedzi.
Okay.
Ndo inonzi menopause iyo.
All right.
But it's not just that. It's not just that. It starts very, very early, because by the time you stop having your periods, you're probably in your 50s. But what they call perimenopause, that's the transition. That's the transition where you start having the symptoms, where your periods start fluctuating, where the hormones within the women hormones that we have in our bodies, they start to fluctuate. Hormones like estrogen, progesterone, and testosterone, they start to fluctuate. Sometimes they are up, sometimes they are down. And that's when sometimes we are happy, sometimes we are in a really bad mood, sometimes we feel depressed, sometimes it's because the hormones are fluctuating.
So is it strictly when you reach the age of 50 that you get menopause? Why I ask that, Auntie Sita, is I've got a friend who stopped having her period in her 30s.
So there are stages of menopause, let's discuss the stages, right?
Okay.
So the first stage is perimenopause.
What is that?
So perimenopause, it can start as early as in your late 30s. I started, looking back now, I started my perimenopause in my late 30s. I think I was about 37, 38 when I started to get the symptoms.
When you say perimenopause,
so you continue having your periods, but my periods are no longer as ndinotanga period in 5 January and I know my periods finishes in 10 January. I always go for 5 days. Or period yangu is very light. There are people who say period yangu is very light, and there are people who say, oh, my period is, it's very heavy. So depending on where you are, you start seeing things like your periods start fluctuating, where they used to start to have to go on for 5 days, they might go on for 7 days. When it used to be light, it might start being heavy. Where it used to be heavy, it might start being light.
Oh.
That is what, I think that is what people start seeing. But I didn't see that. But that's definitely one of those symptoms that you start seeing.
My changes in my periods.
My changes in your periods, yes. They become heavier or they become lighter, they become prolonged or they become shorter, depending on where, what was your norm.
Okay. When I was growing up, isusu taiziva kuti taidzidziswa kunzi period dzako une timeline yaunofanirwa kumaka nekuziva maperiod ako. Saka mukukura kwedu vazhinji tainyatsoziva kuti period yangu iri kutangira kunana 15, 16 uko. And kazhinji zvaisa rasikaba.
Yes. So when you're entering perimenopause, which is, it could start in your late 30s, that's what you start seeing. Pawaifunga kuti, my periods angu anofanirwa kutanga musi wakati, wonzwa umwe akuti, oh, I've been late this month.
Right.
You see, I've been late this month.
Okay.
Or I'm early. Or, oh, my periods were a bit light. Or, oh, my periods were a bit heavy.
Okay.
And perimenopause will last for several years. So if you think about it, I started having symptoms when I was 37. I didn't go into menopause, which is that period where your period has stopped. You've stopped having periods for at least 12 months. You have to go for 12 months without a period. Then you are in menopause.
Okay.
So I am in menopause because, so think about it. Since I was 37, I was having symptoms, say, perimenopause, since I was 37 until I turned 51.
That's a long time.
It's a long time.
You know what you've just explained. I went to see my GP in Ezuro. Inini ndaitozviti ndiri menopause. And then she asked me kuti, when was your last period? And then kubva ndamuudza kuti it was within beginning of this month.
Mm.
And then vaati amuzi mu menopause.
Yeah.
Muri mu
Perimenopause.
menopause.
Yes.
Okay.
Yes. So if you're in perimenopause, yeah, it can start from your late 30s into your 50s. Some women go into menopause at 45. Some women go. I went into menopause when I was 51. That's when I actually said I haven't had a period for 12 months.
Okay, so it's strictly if kana usina kuita period for 12 months,
yes.
it means wamu phase ye menopause.
Wamu menopause. Yes. But let's talk about, that transition.
Ye peri to mono.
Yes.
Peri to mono. Okay.
Because that is where everything happens. Let's talk about the symptoms. What are the symptoms? So you start feeling, yes, my periods, but your body starts changing. How? Right. Hot flashes. That's what we know about menopause, isn't it? People will say to you, I've had this hot flash. You see a lot of women fanning themselves.
Educators,
fanning
hot flashes.
Hot flash is exactly that. You
feel hot,
this rush of hotness, and you sweat. You literally sweat for about 5-10 minutes, and then it goes. It doesn't matter whether it's hot or it's cold. When a hot flash comes, it comes. And even if it's snowing outside, you actually think, I'm gonna go outside.
Saka ndozvotainzwa namai vedu vachingoti ndiri kupiswa even kuchitodora ungoshaya kuti kumunhu ari kudikitira zviri kumbofamba sei. How is it walking?
I know.
How is it going kuti mai vanoti vari kudikitira and yet it's cold. Ndo anonzi hot flash.
But to be honest with you, your hot flashes are the least of your problems.
Oh.
They are the least of your problems. There's other, symptoms. I suffered anxiety. I suffered sleepless nights. I used to go to sleep around 10:30. By 12:30, I'm wide awake. I cannot go back to sleep. And you know what happens at that time? Your stomach is bubbling with anxiety. Anything that's in numbers were saying, unoaruka madweri ugoharudumura ugochka. That fear of that feeling of fear, and you think about, why am I so afraid? Why have I got this feeling of fear? And you don't know. That feeling of, I feel so sad. I feel sad. The feeling of I feel sad, depression. That is depression. I had that feeling. And I used to say to my husband, I feel sad. And he would be like, why are you sad?
And you don't know why you are sad.
No.
And iyo yekuchika yamuri taurai. What led me kuisa camera is ndandangopinda all of a sudden ndandane maphases ekuti ndinonzwa kutya uye ndinoita very anxious and anxiety of the unknown.
Yes,
I don't even know why I am anxious.
Yes.
And so I ended up putting a camera ndichitoti ndiri kuti safeguard because ndiri kutya panapa handiwanzovhare maketeni but ndandaku it has shut all the curtains manero.
Yeah. So I think what we want to do is to spend some time talking about my symptoms because menopause.
Okay.
Because like I said, there is about, the other day I was listening to this doctor of America, and she listed about 70 symptoms of menopause.
How
70
many?
Symptoms of menopause. So we've talked about hot flashes or night sweats. I suffered night sweats. I didn't suffer hot flashes. So hot flashes is when it happens anytime during the day, But at night, I suffered night sweats. This is where I used to, wake up in the middle of the night, dripping in sweat.
I can see as I'm looking at the comments
dripping
as you are talking that people are agreeing with what you are saying. Zim Celebs is saying kuti she felt like she was in an oven first year. And she also said she's having only a maximum of 4 hours sleep.
Absolutely. Yeah. I mean, 4 hours. To me, 4 hours was like, and 2 hours. 2 hours. So let's move on to the next symptom.
Let's go on.
So we talk about mood swings. You know, you get to a stage whereby everything annoys you. 1 minute you are happy, the next minute you're not happy. Everything annoys you. I mean, the person who went through this is my husband. And you know, kungofonerwa kudai kunzi uri right here wasvika kubasa aiwa kani mairo ndiri kungofona unzwa kuti ai usandifonere. And I mean, you know my husband. I mean, he's the gentlest
of the gentlest.
Exactly.
Yes.
And it was genuinely every time kind of basa unofonerwa wafamba zvakanaka, and then it just started. Ndakungopopota. Urikupopotei? Urikupopotei?
Wow.
Any little things zvinenge zvakungoko anoya kana kufema chaiko. Fema zvakanaka. I mean, it's honestly, I know we are laughing now. But it's not a laughing matter.
No, it's not.
You actually think you're going crazy. You actually think, ndakupenga. Anxiety, we've talked about anxiety. The problem with anxiety is it knocks your confidence.
Oh, big time.
It knocked my confidence, Kumas. At that time, I was an associate director of nursing. It knocked my confidence big time. Where people knew, Sita, this is the Sita that we know. Everybody was asking me, you okay? Are you okay? Say, hey, are you okay? No, I'm not okay. I'm not okay. Poor sleep, we've talked about. One thing that people do not talk about, and this is my big thing. No one talks about the symptoms. Vaginal dryness. Painful sex, vaginal dryness.
Menopause.
Perimenopause. Going through perimenopause. Your vagina shrinks and becomes very tight to the extent you can't even wear, for those of you who wear matongs, those of you who wear a pair of jeans, tight jeans, you can't because it's painful. You know, the skin becomes very thin to the extent that sometimes you can actually bleed if you wore something very tight. I used to wear my thongs. I ended up not wearing them because, you know, it was so uncomfortable. It was rubbing. It was so uncomfortable. And then it moved on to say, honestly, it was like you become a virgin all over again.
Oh.
And that actually makes you not like your partner because you're so scared. It's so painful.
Saka, is that probably what causes vakadzi kusvika pakusada kusangana nevarume vavo?
Absolutely.
Because of the vaginal dryness.
The libido goes. You have no libido. You have no, you know, it feels like when libido goes out of the window, libido do kuda kwako sex. It feels like when it goes through the window, what then comes is that, you know, you just don't like your partner. It's just like, I don't like you. Don't touch me. Don't. He doesn't know what's happening. He doesn't. I'm just like, please don't touch me.
And magara munobatana. all of a sudden wakuti don't touch me.
Don't. It gets that, it got that bad for me. And you know, it makes me emotional, because no one needs to go through that. You don't have to go through that. What you need to understand is, as a woman, at some point, you are going to go through perimenopause and menopause.
But tine problem.
And if you know about it, there's things you can do to make sure. Because I thought I'd gone into depression. I thought something was wrong with me because I didn't like my husband anymore. At that point, I didn't know I was going through menopause.
Just ndandinoda kuti tine problem because atina ruzivo rwakanyanya nekudzidziswa kwakanyanya kwemenopause, especially mu-upbringing dzedu isusu.
Ndakabvunza mai vangu. You know, a lot of people know my mom. You know my mom. I asked, you know, vakapika vakati handina kutomboenda iwe mairoi uri kungotaura zvemenopause, isusu hatina kumboita menopause, iwewe sakati.
Unowanzi hatina kumboita? Hatina
kumboita, hatitomboziva menopause chii. But also you need to think about this, right? I remember Kumba, tichiri Kumba, and I remember that you could see a couple, an older couple, vanenge vachidanana for years and years and years, vachidanana. And then they get to a certain stage where the husband marries a younger woman. And Mbuya Chitambo, vanenge vangoripo zvavakagara vachitozvifarira kuti ngazviitike.
Because you are actually feeling yacho.
No, don't touch me. Kana uchitoda chaga umwe mukadzi wechidiki.
Is that why taiona mukukura kwedu ana baba nana mai vakugona kurarama separate bedrooms?
Exactly.
And zvaingo explainwa kunzi takura isusu ana mai vaibva vati takuda zvekungorara nevazukuru, ndo zvavaibva ivataura.
Or different beds in the same room but two single beds. You see that?
Asi kuchirungu munoziva kuti zviri common two single beds. Zvokuti mune muchidanana zvekudanana zviya, but matone ma-separate beds.
Well, you know. Okay, going back. So we've talked about libido, we've talked about vagina. Honestly, vaginal dryness is a thing, and you don't have to go through that. There are, you know, I'm sure Auntie Selina would want us to, you know, do another session where we can talk about what can you do, you know. You know, there are creams, there's things that you can do to avoid, you know, to try and
to alleviate the dryness.
The dryness.
All right.
Yeah.
Okay.
Things that you
okay.
But also there's things like lethargy, tiredness. You feel exhausted, drained. In Takabuda Chenda shopping one day in Nabaroi. Poor Baroi gets mentioned on live. And you know, and we went out and we were going out for shopping. Literally walked out of the car a few steps, and I looked back and I said,
I'm tired.
What's wrong? I am tired. You know, you feel the exhaustion here, Yakuti. That's how I feel anyway. I felt anyway. Yakuti, it's like someone has put a syringe in you and drawn all of your energy.
Yeah.
That's how it felt. I just felt, I can't do it.
Yeah, in Pandino Yapaman live, sometimes I always use the word I'm exhausted. I use that word a lot.
But we think it's normal because we are hard workers, you know, we work so hard, we're women, you're looking after kids, you're doing this, you're doing this. I remember when my kids were still young, Christmas, you would be running up and down like nobody's business. Yeah. Not even one day you would think, I feel tired.
I feel tired, yeah, right.
Now I look at the younger people, and they are running around, and I'm like,
how are they doing it?
How are you doing it? And I forget, I used to be like that, you know. And the problem is, when you feel that way, Selina, you push it aside, you just think, oh, what's happening with me? Is there something wrong with me? If you don't know what's going on in your body, I tell you now, it will drive you mad. It will drive you crazy.
I think those stage yandasvika. Inini I'm forever. Let me say I'm forever exhausted. To the extent yekuti ndinorara a few hours dzandinorara. Mumwe munhu akambondibvunza kuti mune muchiposta nguva idzodzo mune zvinenge zvichifamba sei handiti tenge takatomuka asi kana ndangorara 3-4 hours dzandine ndarara ndamuka I've reached a point whereby kumuka chaiko kubuda mubhedha ndine ndichimbonzwa kuneta zvokuti ndinotombogara maimi. You know what I've resorted to? Kutora katsvimbo kekuzviaida.
My Selena is younger than me, by the way. Honestly.
I know.
But that's the thing, you know, there is talk at the moment, you know, there is this doctor who talks about menopause and its effects on people, on joints. There is what's called, what do they call it? Frozen shoulder. It's called frozen shoulder. I can't reach at the back. I can't. That is a symptom of menopause. You know, my joints. You hear a lot of women complaining about my knees, my hips.
Saka my frozen shoulder is linked to menopause.
Absolutely, yes. Frozen shoulder is linked.
Saka frozen shoulder. Nigga freeze.
But unongomuka one morning and you feel pain in your shoulder and you can't move it, so you can't reach you can't you know, so you can't, and it only happens on one side. You can't have it both.
It's only on one side.
I'm saying you can't have it both, but most women I have a frozen shoulder and it's my left hand side. So I can't lift it, you know,
as much as you used to.
It's painful. Because it's painful. Knees, all your knees, your any part of your body changes.
Saka probably inini zvandandi kufungira kuti ndo zviri kukonzera. It might not even be that.
No. Yeah. You need to think about, you know. Did your doctor talk about HRT?
What happened is, yes, and I akandiudza kuti hanzi HRT comes in 3 different forms.
Yes.
I didn't know. I thought
HRT.
HRT. I thought
hormone replacement therapy.
Hormone replacement therapy. Ndangofunga kuti ipatch chet.
Yeah, it is a patch.
Pane gel.
Yeah, pane gel.
Ne tablet.
Yeah, I should have brought it. Tablet is not from an estrogen point. So we talked about 3 hormones, right? So you have estrogen. Estrogen, that's your main hormone. When that starts fluctuating, that's it. That's the one that affects your brain. That's
estrogen.
The one estrogen. That's the one affects your brain. That's the one affects your bones. That's the one affects your heart. That's the one, you know, that is estrogen. So for them to replace that estrogen in your body, what they need to do is to give you either a gel. It's a small gel. I should have brought it, where you just put it
okay.
Or they give you a patch, like Nina put a patch here, where you stick it just below your waist. You stick it there, and you change it every twice a week. Or tablets. The way I was told about tablets is that it has a high risk of clotting of
blood.
Yes. So right. You have a high risk of getting pulmonary embolism, you know. So they don't recommend. I know there are people who are on it, but that's not the best treatment.
Okay, because in Nezuro, I haven't actually done it. I want you to go and research there's some information that he's not agreeing with, but she said, she said, I want you to go away. I can't do me that link. Go and explore it in a patch form, in a gel form, in a tablet form.
Yeah.
But tablet, as you have explained, I wouldn't really talk about it. But regarding we are talking about it kuvanhu kwazvinowanika zvinezvi. Vabiye wedu kwazvisingawanike zvinofamba sei zvinezvi?
I think that's the problem, isn't it? It's inowanika everywhere, let's be honest. HRT, you can get it everywhere. As long as a GP can prescribe it, you can get it in every pharmacy. So it doesn't matter where you are. Maria Komun, when you are in some country, in countries like, let's say when you're in Zimbabwe, here in UK, I get my HRT, I have a certificate, which I pay for, I think it's about 25 pounds, 22 pounds per gore, and anything to do with HRT, I get free. Not I get free, I get because I've paid that 22.
All right, so which means you're telling me, probably ndikanzi HRT,
yes,
it's not covered by my prepaid prescription.
It is.
It is covered. I've got prepaid, which I pay the whole year.
Yeah, but it also depends if you have a, like I have thyroid problems, so I take thyroxine. That automatically makes me, I don't have to pay for any of my prescriptions. So every prescription that I get it free.
All right.
Yes.
Okay, just like with some things you get my prescriptions
free. And if you're 60, in this country, when you're 60 years old, you don't pay for your prescription.
Is that so?
Yeah.
Oh.
I know. Yeah. Okay, so going back to our symptoms, then there are lots of symptoms. Please, next time when you do this, I think we will bring a whole
lot of my symptoms.
Yeah, my symptoms. Or I can put the symptoms on the comment section after the live.
After the live, okay.
Yes, yeah. So but it's not one size fits all. Like I'm saying, it hit me really, really hard. Really hard. When I say really hard, I thought I was dying. I thought there was something wrong with me. At one point, I thought I had TB. Because I used to sweat at night, but it wasn't sweaty, I'm hot. It was sweat of I'm cold. So
you can also sweat when you're cold?
Yes. When you've got your duvet, and you start sweating, but you can't take your duvet because you're cold. So you do this to the duvet, and then it gets wet and wet and wet and wet and wet. And then when I know it's finished now, I'll take the duvet off and change it and put another one because it's that bad. But now, as you learn as you go along. So I used to have towels near me at night. When I start sweating, I just take a towel, wrap myself with a towel, and then when it's finished, take the towel off. It's not one size fits all. I just want to emphasize, some people will have it really bad. Some people will not have it really bad. But it doesn't mean that you are not going through perimenopause or you're not in menopause. Because every woman, you will go through that phase.
But I think kumusha vanhu vazhinji fanka ana mbuya vari kumaruzevha tichitaura kudai handitombofunga kuti kana wedhi racho vatomborinzwa.
But to be honest, I hear a lot of older women kumusha who complain a lot of mavi.
Oh yeah?
Yeah, more than men, if you think about it. But also remember, women, get dementia more than men.
Huh?
Yeah, because of estrogen, because of hormones, estrogen.
Okay.
So anambia lukumsha, yes, women can live longer. They live longer than men, but the what's the word? But the life that they're living,
the
quality of life is not
there.
It's not there because you end up going in a nursing home. There's more women
in nursing homes than men. Yes. I've noticed that.
Yes.
I've noticed that.
Yeah. So, there is a lot to understand. But I think what I just want to say, what I want to say is, maybe if you asked me what was my turning point,
yes,
what
was your turning point?
All along, I've been suffering. I've been going to my GP. My GPs, the guys call them antidepressants. I was put on antidepressants, fluoxetine.
Antidepressants?
Yeah. I was put on hypertensives, my high blood pressure tablets.
Ooh.
I was put on that, not for high blood pressure, but for sweat, for the sweating. And I was, so a lot, my GP did not understand. He was an old-fashioned GP. And I used to talk to him and say, something is happening, something's wrong. He didn't understand.
You didn't get it.
He didn't get it. I went to a conference. I went to this conference where the title of the conference was From Boardroom to a Mental Health Unit. And in my head, I was thinking, oh, it was something to do with mental health. But when I got there, there was this woman who was an ex-chief nurse talking about how she went from 9 o'clock being in a boardroom having meetings to 3 o'clock having been admitted in a mental health hospital. And she told her story, and she said only if she knew she was going through perimenopause, because she strongly believed that her mental health was so bad because of perimenopause, of these symptoms. So that started anxiety, everything. Yeah. And that's when I left that place thinking, wow, this is what I'm going through.
So probably depression tinogona kutoenda mudepression, but kana usingazive usingagone kuilinka to the menopause.
But why would in I suddenly went into depression? I'd never suffered depression. Never. I'd never suffered. I didn't even know how it feels when you've got depression. All I could understand is what I read in the books and what patients tell me. I'd never suffered it. And that was for me, aha, this is what I'm going through, right? This is what I am going through. So at that point, my GP had referred me to a gynecologist.
I'm in that phase as well.
So my GP, but for something else. So the reason why my GP was for something else, it wasn't to do with menopause, it was something else. So when I went to see this gynecologist, luckily it was a woman, and I said, just forget about what I've been referred to you for. Can we talk about menopause? And she listened. And I sat there and I cried my eyes out and I told her everything that was happening. And she said to me, I will sort you out. And she did. She gave me a patch. She did everything that she needed to do, blood tests, everything. And then she gave me a patch and she said, if you don't hear from me in 2 weeks' time, get your prescription and start using it. So even the way I walked out of that room, I had a little step in my, I actually felt better because I felt.
Because you had gotten to talk to someone who was hearing you.
And I was like, what? So I'm not crazy, right? Everything I'm feeling is real. It is perimenopause.
Ooh.
2 weeks later, I slapped the patch. And my God, honestly, it was like, huh? Is this me?
So are you saying the patch was your turning point?
Oh, yeah.
Patch was your turning point, your menopause.
Within 24 hours, I slapped it on Makusen, Nas. The next morning, I jumped out of bed, whereas I would crawl out of bed because of pain. Pain. You know, you have that pain in your body. But I felt like, have I been in a car accident? On that day, I woke up and my husband looked at me and said, "Hey, Chicha Itika." That was his question. Chicha Itika.
Chakupai kuti mudaro. So you're saying HRT itori is effective.
Oh, yeah.
Is that?
They tell you it takes about 12 weeks, which is right. But for me, it was literally 24 hours. Literally 24 hours.
And that was your turning point
That was
from
my
all
turning
the
point.
things
Oh my God.
that you were feeling.
Oh my God. You know, even I'm talking about vaginal dryness, right? I could feel the
twinkling. The wanting.
I know but it's not a laughing matter. This is serious business. And the reason why I talk about it so openly is because when people talk about menopause, perimenopause, all they talk about is hot flashes. Says the things that actually affect your life, your work, your relationship, your intimacy, nobody talks about it. And yet those are the important things. Don't get me wrong, I chose to go for HRT because I was that desperate. And you know, the prescription HRT, I literally grabbed it. And now if you tell me, I even feel anxiety when my HRT is getting finished and I'm thinking, I'm gonna miss out. I'm gonna go for days without it because that on its own makes me feel anxious. I can't do without it.
And I like what you said, and not probably, and I do agree with you. Kana vanhu tichitaura nezvemenopause chinongotaurwa chete ipapa mahot flashes. Hatinzwe zvimwe zvese izvi zvekunzwa kusada kuningirikira hazvitaurike. Zvemajoints zvese zvatiri kutaura izvi hazvitaurike. Ndaona Rosie aripo achitaura zvekuti anzwa necold shoulder nemajoints. Zvinhu zvisingataurike. Tinenge chingoti apamwe kudi chembera. Ndozvatinenge tichitaura. But tichitaura kudai nezuro pakataurwa zvebrain fog futi. So it's one of my 70 amataura kuti zvakawandisa.
Brain fog, honestly, I forgot to say about it. Brain fog, literally, unoita unga pfungwa dzako dzapeterwa mucotton. You do not think. You can't. Even now when I talk, you know, I forget some of the words. I don't know how many times I've said to you, what's that word? How many times have I said, Selina, what's that word I'm trying to say? Don't get me wrong, this is menopause.
Let me say out pamberi pevanhu what I do. Ndinenge ndiri mu conversation like this having a life. Most of the time, if people have noticed, ndinoti tichitaura nezveizvi.
Yeah.
Tichitaura nezvei.
But when you get to that stage of tanga tichitaura nezvei, there is a time when, think about, you are in a meeting, kubas, and you forget what you wanted to say. I remember during COVID time, think about it, COVID time, we were sitting in a boardroom and talking about COVID, and I forgot the word COVID-19, and I was like, you know, what's the infection? Everybody's looking at me and thinking,
what infection?
What are you talking about? And then someone said, COVID-19, and I said, yes.
Yes, that one.
I'm a person who's quite, open, and really I'm not easily fazed. But if it was somebody that knocks your confidence, because and you start thinking, I can't speak in front of people. I can't, because you forget words. I forget words. I have to write things down. Like now, I sometimes forget what estrogen is. So I have to look in the words that I think I will forget. I write them down all the time. How many times do I go upstairs and think, ndainge?
I know.
Ndainge kuno?
Ko ndiri kuenda kupi kana uri mutaundi? Ndiri kumboenda kupi ko?
Kodi zvawapindira zvacho mutauni hapana kana wani chaunoita. Unodzoka kumba ugofunga kuti kwanti ndo zvandandainga kutaura. Honestly, ladies, this is not something. Yeah, a lot of women have left their jobs because of this. A lot of women, especially here in the UK, a lot of women, they leave their jobs because of it.
But what I've seen since ndiri kuendawo through that is inogona kutokubvisa pavanhu sekutamba sekuseka. And you just want to be on your own always because of zvaunenge uchifila. Like jokingly iyo brain fog iyo yekukanganwa muri makagara muchitongowadzana yenyu semadzimai anditi. If you keep on doing it, vanhu vanotongoti asi mane dementia jokingly kazhinji. But ipapo unotenge uri kuziva zvauri kutaura, but you can't really say it.
Yeah.
So HRT was your turning point.
I always say HRT saved my life. That's my way of talking. It saved my life. At that point, it did save my life. As the good thing was, and the other thing is, I started learning about it. I started learning, and I was very lucky because my husband was so interested in understanding what's going on. So he also started researching and learning about it. I mean, he probably knows more than I do about menopause and perimenopause, And that actually was really good because he then knew how to support me. He understands. When I say I'm feeling this, he understands what it means.
Whilst you're talking about that and your husband having to support you in what you were going through, ndikutarisisa vakadzi vazhinji that are going through menopause and vachireacta to the way yezvimwe zvatataura yekuti haachadi kuguma, haachadi kubatwa, haachadi kudi. I feel kuti varume vazhinji kana kuti isusu wacho hatisi kutoziva zviri kuenda through us as menopause, zvekuti kublema varume zviya, zvekuti anozopedzera pamwe akutoda kunotsvaga kunze nekuti iwe hausina kubatwa, hausina kugumwa, kana zvaita wakuti zviri kurwadza, whatever. I think men need to be educated.
They do need to understand what's going on. They do.
But how can they understand when we don't?
Exactly. That's the whole purpose. That's what I want to achieve. I would hate any woman to go through what I went through. I want people to understand what's happening with their bodies. I want people to understand that you don't have to go through that. You can go through it, but at least know what is going on. Yes. You will go through it, but there's no reason for you to suffer.
Yeah.
There's no point to suffer because there's things that can happen. I know a lot of people don't like HRT because of the studies that happened in America, and a lot of people, they think HRT and they think breast cancer. Actually, I made a choice. I thought it takes years for someone to have breast cancer, right? If I can live those lives, the life I would like to live, I choose HRT.
You know side effects there,
not that I know of. It's a medication.
Well, with every medication, there's side effects.
Yes, anything. That's why you really have to be informed and you make an informed choice of what you want to do. Okay. I made a choice. Now I am on. I've got testosterone, and I think this is another topic for another day.
Okay.
So I'm on testosterone. I'm on progesterone, and I'm on estrogen. So testosterone is known for men,
Men,
but
yeah.
women, we've got it too.
Oh, is that so?
And in perimenopause and menopause, it declines. And when it declines, it means that when your libido goes off the road,
jiggy.
No, but also that feeling of tiredness, also, that feeling of tiredness. That's what your testosterone is for. Again, for me, when I was prescribed testosterone, it was like, things started, my brain started functioning. It gave me that,
It started opening up some things that were shutting down.
I remember thinking, I used to, when you're going into, for me, it was going into meetings and reading papers. I couldn't read and understand it with just one read. I had to read and read and read and read and read. But I just find myself now, I just need to read it once and I understand it in my head. And I'm like, where were you before? Kind of thing. Why did I have such a life of spending hours and hours and hours trying to read one paper to understand it?
Chatinoona imwe nhamo yacho yatiinayo is because tichikura taingonzwa izvo zvemahot flash zvekupiswa izvi. So you find kuti probably vamwe vakadzi excuse, vari kutoenda through that, and because we don't know kuti masymptoms emenopause anotosvika kuma-70 koma muchitaura ikoko, tinongoconcentrata nemahot flash. Saka unongoti mai vangu ndakambonzwa vachitaura zvemahot flash, pane nidhi yekuenda kupi kwachiremba here? Hapana nidhi. Usingatoziva kuti majoints ava akutoita kunge wakanhingirikira, it's part of that. Usingatoziva kuti anxiety, kukanganwa ikoko, it's part of that. Handizive kana kuine kwapo even paFacebook kuti panotaurwa zvakanyanya, to say the truth.
There's a lot about Caucasian people.
Yes.
They talk, the European people, they talk
about it
a lot.
Yes.
But isusu vanhu vatema, especially for us from Zimbabwe, all we hear from our colleagues, but we don't go out there and talk about it. People actually feel it's they feel ashamed. I'm glad to say periods, bye-bye. Whereas people sometimes they ashamed because it's a relief. It's an age where some of us have at that age. It's like pension, right? There are people who are not a pension and they enjoy their pension. Yes. And there's people who don't. Why? Because they die before their pension.
Yes.
It's like menopause. When you get to menopause, you're like, how? I'm 58 now, and I'm glad I'm 58 and I'm loving it. If you were to ask me, honestly, which era do you want to come back? I would choose in my 50s.
Would you?
Yeah. I would choose to come back in my 50s.
Wow.
Yes. Because of clarity. I know what I want, what I don't want. I know, yeah. And it's all to do with me being in menopause.
Okay.
Yeah. I mean, no one can tell me what to do now with my life. I know what I want.
Definitely, yeah. You reach an age whereby you know exactly what you want.
But that age is this age. Because you can't have that when you have 5 kids to look after, and all the relatives, all the kids, they all rely on you.
Yeah.
So they actually, detect the way you're going to live.
Yeah.
But now nobody detects the way I live, Yeah. So I love this.
Wow. I'm sincerely hoping that we will have more talk on this, because as you said, kuti kusaidi rechirungu kuvanotaura nezvazvo. Kwedu I even see paFacebook atinyanyotaura maringe nechinhu chinonzi menopause. honestly, from the talk yataita, I've picked up a whole lot of things. Zvana anxiety, cold shoulder, izvo zvemajoints, asi kana ndiri kutambura nemajoints, kana ndakusumuka ndikati kusumuka uku handiti. But my question is, as we are talking, how many people know kuti kune some other things zvinoenderana nemenopause other than hot flashes?
Oh, that's
Ndomubvunzo,
yes.
of which we are going to have a whole lot of episodes,
yes,
to talk about menopause. And I'm so happy to hear kuti matauro kuti pamtone your turnaround was HRT.
Yeah. And next time when you do, I will bring them. I will bring the HRTs so you can see what I'm talking about, what it looks like, and yeah.
So
I think it would be well.
Mapecha akakura steregerenji.
Not really.
Tudugudugu.
People come cut
That's
a patch.
Just for you to see what the patch looks like. But it's a clear patch.
Yeah, it's a clear patch.
Saka mune chirimo. So you're telling me there are things loaded in there that aid you to function the way you are functioning now.
Yeah.
Wow. Wonders never cease, do they?
Yeah.
Wow.
I suppose the other question, as we wrap up, Auntie Selina, I think the question would be, why this conversation matters to us?
Why does it matter?
To us.
Does it matter? And why does it matter?
It does. In our culture, menopause is not often discussed.
Yeah,
as we've said.
True. Very true. Very true.
Our mothers and aunties went through it, but they will not
talk about
it.
Yes.
They will not talk about it. I suppose talking openly breaks the silence and helps women to know they are not alone. We need to know that, we're not, if anything is happening to you, you're not alone. Encourage men, husbands, sons, brothers. My son knows about menopause more than anyone because I talk to him about menopause. One day she said to me, "Oh, Mom, there was another woman wherever was going like that." And he said, I gave her your blog so she can read about it.
She can read.
You got to be careful. You're gonna be telling everybody that they're going through menopause.
And talking about that, you've got your own blog whereby you talk about menopause,
midlife, real talk midlife. It's a blog. I mean, we can put there's loads of stories there. There is loads of information. What I will
also do is after we get off there, I will put a post with your blogs so that people can visit and see what you will be talking about.
Yeah.
You are on Facebook.
I am on Facebook
as Sita Chitambo.
Yes.
That's her Facebook page, Sita Chitambo. So follow Sita Chitambo, SITA, and then Chitambo, CHITAMBO.
Yes.
That's her Facebook page. She is also on Instagram, and it's Real Housewives of Stevenage. But I will post my pages so that you can follow and hear her talk. What I'm intending to do is tichaita 1 or 2 other sessions on this page, and after that, then I'll release you guys to go over to her page so that you can hear more, so that you can be sending your questions in the comment section. Probably can have any time wachiku pindura there and then as she does her lives. So when we have done 1 or 2, she's now going to open up my lives equita so that she answers you direct my questions. And because to say the truth, makoma sitaka menopause kwedu kwatinobva isusu it's untalked.
Yeah,
It's untalked about.
Yeah.
And pane zvamataura zvandibata kuti zvimwe zviri kutogona kulidha varume kuti vabude zvakalenga-lenga, although tisingazviencourage zvinhu izvozvo zvekuti handigone kubatwa, handigone kudii. Saka what can be done for men kuti vanzwisise kuti kune zvinhu zvakadaro zvokuti mukadzi anosvikawo pakuita nguva yekudai.
But it's about talking about, it's knowing, it's knowing. Knowledge is power. If you tell your husband, if your husband knows that when you get to a certain age, things start to change. The problem is we want to be young and we want to continue to be young. But you can't be young forever.
No.
Your body changes. You start putting on weight. You start having this party. It's all to do with your hormones. It's all to do with your estrogen. It's all to do with, that's what it's all about. And if you don't talk about it, then, who's going to talk about it for you?
So I think the more we talk about it, and the more you are going to continue talking about it as people follow you, is the onus is now on them to be talking about it to their husbands as well. Kutongoita general talk, iwe Shaz, nasindadzidza kune chinhu chinonzi menopause. Kana tasvika menopause, this happens. As they heard you explain. Hanzi mabve anotodai, hanzi zvinotodai, hanzi kunotobva kwasungika. Just like you were able to explain to your husband about menopause. Hence, he was able to support you in your menopause because he understood what he was going through. I think varume nekusaziva rudzidziso rwemenopause vanenge vakutongoti ndingatadze kunotsvaga kunze here, but nekuti vanenge vasina kudi kudzidziswa nekuti urungoramba, of which hatizviencourage kuti vaite, but zvinhu zviri normal. Asi ini handidi kunyepa. In as much as I'm called Auntie Selina, izvi zvekuti hanzi nigirikini kune tenge kwakutooma uko. Aiwa, ndiri Auntie Selina hangu ndandisingazvizivi. In fact, zvizhinji zvamataura ndandisingazvizivi. Asi zvandiri kuexperience inini is the tiredness, the anxiety, the forgetfulness. Zvieta ngatichiti chizvi izvozvo. Izvi vanhu vari papa vari kundiwacha, they can pupura that kuti ndo system yenyu mazuva ano Auntie Selina. So I'll leave you to say if there's anything that you need to say before we close down, and then I'll post my links in you so that people can follow Sita Chitambo kuti udzidzeka zvakuda vari kupeji kwavo chaiko iko vachinyatsotsanangura. So if I put the pages, go on your page, click and follow so that you get more information. Already fanika ku Instagram kune some videos about menopause.
Even Facebook, there is quite a lot of information.
So both ways, Facebook and Instagram, there is quite some information about menopause. Okay.
And I've just put something on the comments here, which is about men.
Varume vanoenda kumenopause.
Tiri kutaura nezvevarume tiri pane zvevakadzi. Varume, they get everything they want. There's a lot of research about men, which there isn't a lot of research about women. Saka ngatimbotaura
nezvevakadzi. Okay, got you.
Okay, so thank you so much. I suppose my closing word is menopause is everyone's business. Please do listen to your bodies and seek help and not suffer in silence.
Sure.
I would invite you to read my blog, Midlife Real Life. I have posted one of the blogs on here. And thank you, Auntie Selina, for allowing me to come onto your platform, for inviting me. And hopefully this is the beginning of many programs on women well-being going forward.
Yes. Okay.
Thank you.
Thank you so much for accepting to come and talk to us. I guess zvikataurwa nemunhu ari padhuze newestereki, you tend to understand. Because tinogona kuita ka-defensive kana zvichitaurwa nanani nasomeone. So thank you so much for accepting to come and grace this platform as we talked about menopause. I heard you saying, let's not suffer in silence, but let's talk about it. So we did talk about it today, but there will be a whole lot more that you are going to be talking about it, and we will be learning from you.
Thank you, Auntie.
Thank you so much. When Tambodzidza, let me go to the comment section. Ndipo bata mbichana before we close. My TK Makaza, Matofolowa, thank you so much for that. Kukude, and it affects children too, seeing your mother moody at all times. That's a point right there. And then Auntie Sita, vakoma vangu Sita, kwandiri ndivakoma Sita Chitambo, vaisa that link whereby you can click and follow. And titori nemibvunzo yakawanda. You'll get more of her, especially vakuita my live avo vachinyatsozviverengera vachipindura, so you get more of her as she answers your questions. Vachitoti zvekuti kana vakuita live vakaiona vanobva vadhira nequestion iyoyo. Let's break the silence.
Oh yeah, someone Chido mana. I think I know her from Wadlap. Yes, you're right, Chido. Yes, I went to Wadlap. Yeah. She was my senior. Hello, sister. We'll come to your page. Yeah, that's
please click like and follow so that it munonyatsotaurira na vakoma vangu Sita at the same level. Fafi the therapist, how are you doing? Golden Heart, how are you? Murisei, thank you so much for coming. And Vatagavan, Auntie Ellen Yazema, how are you doing? Auntie Majorita Rwire Murisei, my kunde ibi artist Tamile Cummings. Men need to be educated too. You are right, they need to be educated. But if you get educated, then you are going to be their educator. Wekutaurira kuti shazo ona ndasvika menopause zvinodai, so that they will best find a way on how to help you. Auntie Ro zo hanzi ko hair loss zvayo inoita futi hair loss kumenopause.
Yes, yeah.
So it constitutes of the 70s
yes.
So it's not tailor-made. Each menopause is tailor-made for a person. Wow. Yeah. Auntie Majori Murisei, how are you doing? Auntie Spiwe Museka Murisei. I see Miriam says brain fog and memory issues. I think Vakoma has talked about it. Auntie Tempi Ngube, how are you? Auntie Irene Murisei. Rosie Makoni says very true. Ne frozen shoulder. Yavataura iya ne knees. I think in pakaipa one side only. Anti Ethel, anti Mavis wala anti tirikudziza. Well, let me take this opportunity to thank you so much for joining in the program and with your comments as well. I'm hoping that you have seen link so that you click and go and see what is already on your pages in terms of menopause. It starts with you learning and knowing kuti chichi knows menopause and some of the 70 signs and symptoms the menopause, so that you can be the educator of your other half, so that they will best know how to give you the support that you need. So the name is Auntie Selina. Again, let me take this opportunity to say thank you so much for coming. I'll see you 1-2 more times, and then we all move over to your page.
Thank you, Auntie
Thank
Selina.
you so much.
Thank you.
Ndatenda zvangu. You take care, guys, and thank you so much for your coming. If you can share this to other pages, I'll be very grateful. Also, if you can share the link that she has put in the comment section. Actually, where is the link? Can I get it? So that I can pin it. Yeah. Where is the link? iri pasi apa. Tinotodzima tatoiwana link iyoyo. Azviite. Auntie Karen, Masquera say, how are you doing, Auntie Karen? I want the link there. Ndaiona.
Yeah, it's good.
Ndinotoiona chete azviiti. Hatibve pano kana link tisina kuiona. Ndaita kunge ndaiona.
There. I've got it here.
You've got it. Ndoda kuionera iri apa so that I can pin it. Or if anyone, or can you resend it?
It's under Irene Johannesburg runner.
It's under Irene Johannesburg runner. Irene dzinonyora iyo. There it is. Okay. I've pinned her link. So please follow. The earlier you start talking about menopause to your husband and my signs and symptoms of what happens, the better, so that when it happens, vanenge vakuunderstanda kuti ndozviri kuitika pauri. So it starts with us talking about it, even if it's not being talked about senge kwedu kusaidi kwedu isusu. It can always start somewhere with us. Now that we've got someone who has agreed to openly talk to us about it, zvinenge zvakatinakira. And when she does her programs, share my symptoms and it turns 70. It will be a long time. Pamunozoenda through all the 70. And you said, I think you said, if I heard correctly, kuti
yeah. I remember when I started, people were talking about 30 symptoms of menopause. Now they are at 70.
70 and still counting.
Wow.
Thank you so much, guys. The link is at the bottom. Please follow. For those that got in Pakatipe live, you can always go back and listen to the live, and it's worth sharing. Again, follow Sita, Real Housewives of Stevenage. Ku Instagram wariko, ku Facebook wariko. The name is Auntie Selina. Thank you so much, ladies. Take care. I'm out.